The JFK 35 podcast is produced by the JFK Library Foundation and made possible with the help of a generous grant from the Blanche and Irving Laurie Foundation.
And so, my fellow Americans, ask not what your country can do for you, ask what you can do for your country.
Each year, the JFK Library Foundation recognizes and celebrates the quality President Kennedy admired most: political courage. The Profile and Courage Award recognizes an elected official for an act that demonstrates the qualities of courageous leadership President Kennedy wrote about in his book, Profiles in Courage.
But last May, as the COVID-19 pandemic unfolded, Ambassador Caroline Kennedy and her son Jack Schlossberg wanted to recognize the courage and national sacrifice of people on the front lines of the pandemic, people who were going above and beyond their everyday responsibilities to help those in their communities.
After a public nomination campaign yielded thousands of nominations from across the country, 7 honorees were selected who had put their own health and safety at risk to help heal the sick, protect our most vulnerable, and provide critical support services.
Their actions bring to life President Kennedy's call to public service from his inaugural address: ask not what your country can do for you, ask what you can do for your country, by helping their communities at the time when it was needed the most. Last Wednesday, a virtual ceremony honoring their courage was streamed online, and today we're pleased to introduce to you 2 of the honorees in this special episode of JFK 35.
Joining us now for our first interview is Lauren Leander, a nurse at the intensive care unit at Banner University Hospital in Phoenix. Leander has spent the last 15 months caring for the most critically ill COVID patients in Phoenix, but she caught many people's attention when a news photographer caught her standing face-to-face with angry anti-mask protesters at the Arizona State Capitol building, a stark image that was then distributed nationally. This week, she was honored with the COVID Courage Award by Ambassador Caroline Kennedy and Jack Schlossberg for her commitment to her job helping others and her bravery in that single moment at the Capitol. Lauren, thank you for joining us.
Yeah, hi guys. Thanks for having me.
Lauren, you have a story to tell, but before we get to that, why don't you tell me a little bit of background as you were a nurse, what made you want to be a nurse, and how did you find yourself in an ICU?
So I have about 7 years of nursing experience, and I went to Arizona State University. I feel like nursing kind of found me in a way. I was really lost, like I think most college kids were, and changed my major a bunch, but eventually wound up in nursing and totally had that light bulb moment where it just clicked for me, and I knew this was really where I was going to spend probably the rest of my career. So I fell in love with critical care nursing, specifically in school. And I loved the way that these nurses were able to devote all of their time to either 1 or 2 critically ill patients and get to know them and their families in a really intimate way. And so that was my goal, was to spend a year in the wards getting experience under my belt and then working my way up to critical care. So now I find myself with about 6.5, 7 years critical care experience, and just use that time to really work my way up towards being a senior nurse on the unit, meaning I'm able to run different life support machines. I'm an ECMO specialist. I train a lot of the younger nurses that come through, and I'm also a member of the code team at our hospital.
And, you mentioned that one of the reasons you liked working in the critical care was you had that interaction with 1 to 2 patients and their families. What changed when Kavit happened? How did it start and how did it evolve?
Yeah, that's a really good question. I hope that a lot of people know that pre-COVID, the critical care department was a really well-oiled machine. We had, very chaotic days at baseline, but we were able to handle them well. We had enough staff, we had enough machines. And then, we jumped into the first wave of COVID with an already full hospital and trying to make room as these patients came pouring in. So I really feel like COVID sort of just put extra weight on this really well-oiled machine. And instead of taking care of 1 and 2 patients, now we had 3 to 5. And our critical care docs, instead of having 30 patients, they now had over 100. And we really felt like we were just spending our days putting out fires. So that meant putting patients on ventilators, stabilizing somebody, and then running to the next emergency, and doing that over and over again without being able to do what I fell in love with in the beginning of my nursing career, which was that intimate relationship with my patients. So that had to go out the window while we sort of stayed alive during this pandemic.
So what would be the importance of nurses during the pandemic? You mentioned kind of running from patient to patient and what the ICU was like in your ward. How's your role been so important and your colleagues?
Yeah, I think that people are realizing now, even more so, the importance of nurses and the role that we play at the bedside, because we are truly the eyes, the ears, and the hands of our doctors. And we're the ones sort of paddling over the waves while our doctors are kind of the ones, telling us which direction to go, and we can't see. And so it's a team effort for sure. But when these doctors are called away to multiple emergencies over and over again, nonstop for 12 hours, we're the ones there making sure that patient stays afloat and making sure we get those doctors back if they're needed back at the bedside. And we knew that collectively as nurses, so we were also able to support each other. And so there was no, I'm too busy to help my colleague. There was no, I don't have time to help you. We all put all of our effort, not only into our patients, but into making sure our other colleagues stayed afloat with us.
And that sounds like you mentioned having, going from a couple of patients to doubling that and then having hundreds of patients to deal with. How did that affect you and your colleagues emotionally, and how did you deal with that added sort of intensity and burden?
That's a good question. I think we dealt with it the best that we could. We luckily were a very large ICU in the downtown Phoenix area, so we had more machines, more support, more supplies than some of these other smaller rural hospitals. So we just did it the best that we can. And it's funny, I pause at this question because I'm actually not sure how we did it sometimes. I'm not sure how we never stopped for 12, 13 hours. I don't know how we managed to keep our patients alive, keep ourselves alive, and support each other at the same time. It was really just taking it minute by minute, hour by hour, kind of like I said, putting out those fires, dealing with the sickest of the sick first, and then working our way back. I truly am shocked to see how we were able to pull ourselves out of this in the end.
And then going from inside the ICU, there were, around the country, there were lots of protests about what various states and municipalities were doing, and there was one at Phoenix. So what made you decide to go to the counter-protest at the state capitol, and what was that atmosphere like?
Yeah, so the counter-protest was going on in April of 2020, and there was kind of this anti-mask movement that had started to snowball kind of in the last month. And at that point, it was a really crucial moment for us because we were just realizing the severity of COVID and what that was going to look like for us in the hospitals. And yet, on this other hand, there was this massive movement to protesting home, to open up way too early, to ditch the masks. And it was the opposite of what we needed people to do. And so it was really terrifying to see this movement take power. And so I actually just happened to be off work on the day that there was a counter protest. Heard about it through another coworker of mine and decided to kind of shoot out a mass text to any of my coworkers who wanted to come with. And from the beginning, I knew my stance was just going to be to be silent. This wasn't going to be a healthy opportunity to talk to anybody or get into any arguments. And so we went into it pretty bare bone, just in our scrubs, not representing anybody other than the nursing community as a whole and our patients. And we really didn't know what we were going to walk into. We thought maybe there would be, 50 people at most, kind of some angry protesters outside. But as we drove up to the Capitol, there were multiple news helicopters overhead. The noise was deafening. People were laying on their horns. I mean, it was chaos, and there actually ended up being somewhere around 3,000 people there. And so that was terrifying also, to realize the power of this anti-mask movement and to see it with my own eyes, and to then bear witness to it, to plant ourselves in front of the Capitol and hear what these people had to say and look them in the eyes and realize that this was a very real threat to getting through COVID as a healthcare worker.
Did you expect such hostility from the protests and the kind of hatred and suspicion of this, kind of the science and medicine behind everything? Was that so surprising to you?
Yeah, it was very surprising because, historically, nurses have been the most trusted profession across the globe for years. And for some reason, COVID hit, and this movement's faith and trust in healthcare workers and science went out the window completely. And that was a really scary thing to see because we're used to being very trusted and we're used to being somebody that people go to for help. And so to realize how misled this group of people were was very scary. And I think it also shone a light on the power of social media and its ability to spread misinformation and disinformation, because this obviously didn't come from science. This didn't come from us. It came from this group of people sort of creating their own echo chamber and repeating all these lies. And it was scary. It was a scary thing to look in the face. But I do think that anger and that fear turned to empathy pretty quickly because we realized how misled these people were and that their lives were in jeopardy just from being there that day, and that these people could be my patients in the next week. And then even further than that, these people could lose their own lives sometime this year. They could lose loved ones. They could lose friends. And so it turned to sort of an empathetic view of they just have no idea. They have no idea. And I don't know how to show them other than to just be here today.
You mentioned empathy, which is a little surprising, I think, because some people would say, if you were looking at someone being so reckless or, participating in such a risky event, and then you, like you said, they could be your patient next day. There have been other people that have been, very upset because it's like, you're putting your life at risk and then I'm the one that's going to have to save you. It's interesting that you say empathy. Did you feel mixed emotions, or was it really just full empathy?
It was mixed emotions. When we first got there, it was anger and fear and frustration and confusion. And it took us a couple hours of standing face to face with those protesters to get a grip on what this movement was about. But collectively, as nurses, the reason why it turned to empathy for us is because we're the ones that hold the hands of the dying. We are the ones that zip up the body bags. We are the ones that call family members with horrible news. And we don't wish that on anybody, regardless of if they believed this virus was real or not. It was a terrifying thought for us to realize that these people had the same mortality that any of us did. And we wouldn't wish that on anyone. We wished them to understand. We wished that they would see our side of the story and hear our stance. And that's what we were really trying to do that day was just show them that there's another side to the story, that there's people here willing to empathize with them and say, look, that might be what you've heard, but let me tell you what's really going on. Let me tell you what we've been seeing.
After that day, you sort of had a viral moment from the protest where, protesters were yelling, screaming, even spitting at you. And that kind of put you front and center in some of the media cameras. What was it like after that day? What happened for you?
After that day, I learned what it was like to go viral, which was a very ironic concept at the time as we were out fighting this virus. But literally within 48 hours, our pictures from the protest were, they had reached other countries. It was madness. We had gone back to work and, it was like, dang, that was a crazy day, but didn't really think much of it or realize the attention that it was going to get. And then I think being there that day really highlighted both sides of the conversation. On one end, this extremist anti-mask group started getting a lot of attention for their bad behavior and for their misguidance. But on the other hand, we realized how many more people were out there that were on our side, that were rallying behind us and believed in us and still had faith in the nursing profession and in medicine in general. And so it felt like a really cool way to be able to put the spotlight back on us and back on frontline workers and people that truly knew what was going on, and to take that media attention away from that misinformation for a while, because what really needed to be said was the truth.
I'm sure you received all kinds of responses. Do you feel that the chance to, get out there and put yourself out there and put nurses out there and what they do you feel that you made a difference somewhere for some people after that day?
I do. I think we all did. I think nurses and healthcare workers and people that still had faith in us were really just looking for something to grab hold of, and even still, sometimes it feels like our world is just unraveling at the moment. And so to just have a photo or a little bit of time on the media to tell people that we're there fighting for them, I think hopefully made a difference for people, because people were scared. This was just the very, very beginning of the lockdown movement, people staying at home and locking down in the very beginning. So I think it gave people hope. And it was wonderful just to feel that although these anti-maskers were the ones being very loud, that there was this other really powerful movement behind them that we could grab hold of as well.
And as we've seen throughout the pandemic, that it's affected different communities in different ways, with historically kind of marginalized populations getting affected disproportionately. So after the protests that you attended, you and some colleagues started a GoFundMe for the Navajo population. Can you explain a little bit about that and kind of where that idea came from?
Yeah, that idea came pretty shortly after our photos went viral. And all of a sudden we realized there were people listening to us. People wanted to talk to us. People wanted to hear the voices of nurses around the globe. And we had to sort of sit with that and realize, well, what are we going to say? What is important to be said here? And for me, I knew that it was important that people saw the health disparities between populations with COVID, and specifically Navajo Nation and the Hopi tribes here in Arizona, because our ICU where we work is one of the bigger ones in the Southwest. And so we would get patients flown in from all of the neighboring reservations to our hospital. So we had a really good sense for how these people were doing, and they were doing very poorly, to the point where we had entire families from a Navajo community in our ICU. We would have a mom in one unit, a son in another, a father and daughter in neighboring beds. I mean, there was a huge genetic and cultural component to this virus, and I didn't feel like they were getting the attention that they deserved either. And so we had this opportunity to create a platform for them, and we decided to open a GoFundMe, which was just a way for us to raise money to give them what they needed, because they didn't have the hospitals that we do here in Phoenix. They have small rural hospitals with very little ventilators, which was why they all had to be flown out of there. So I said, hey, let's start a GoFundMe. Let's see what we can get. And crazy enough, we ended up with over $286,000 from people all over the globe. And we used that money to locate grassroots efforts that were on the grounds in the Navajo and Hopi communities that were already working to bring supplies and food to their people. So we ended up giving a portion to the grassroots efforts. We used a piece to buy compassion fatigue gifts for the nurses that were working on the front lines there. And then we also used the rest of the money to buy PPE for Kayenta, Chinle, and Tuba City, which were the 3 top hospitals that were being hit with COVID in the Navajo Nation.
Yeah, that's a really wonderful story, and obviously one of the reasons you're being highlighted for COVID courage. We're almost at the end. There seems to be a light at the end of the tunnel, at least here in the United States. Obviously, globally, this virus is going to be continuing, and we're all going to be cautious. But how has this pandemic changed you professionally, and maybe also personally as well?
It's a good question. I think I speak for not only myself, but for any nurse who's been on the front line during this pandemic. But we are experiencing mass burnout at the moment, and also mass turnover. I've watched my unit in particular just empty of all the nurses that used to work there, because we are just starting to seek better pay and better hours and better support so that we can continue to be there for our future patients, but also to look for ways to take care of ourselves for once. The burnout is extreme. It's, for a lot of us, we were working double and triple the amount of hours that we normally would. And for a lot of us, coming out of this pandemic that now looks like sleep disorders, or some of us are having hair loss or low back pain or low-lying anxiety. It's showing up in a physical way now, this burnout and this trauma that we've been through. So I think collectively there's going to be a huge shift in the nursing profession as people start to seek ways to balance taking care of themselves and their patients. But for a lot of us too, we love nursing and we want to keep being there for our patients. And so I know a lot of us are starting to take those vacation hours and take time off and really disconnect on our days off, turning off our phones, going out into nature, whatever that looks like for us, because I don't think we could have handled much more if there had been a third or fourth wave, and we pray that there won't be. I'm not sure how much more we could have handled collectively. So it'll be interesting to see kind of where nurses wind up in the next 6 months to a year.
Thank you. I feel like there's not, as someone who's not in the profession or has not been on the front lines, to understand what the medical profession and nursing in particular has gone through. It is astounding to think about, and I hope that positive things can come out of this. But thinking kind of nationally on a larger scale, is there anything, or what do you hope we as a country learn from this, the kind of the many, many things we've gone through in the past 15 months or so? What do you hope we learn from this?
It's a really good question. I think above all, I hope that our country can learn what it means to put health before economy, because that was a huge conversation and still is to this day, of how to balance having a working economy, but how to balance, keep taking care of our patients and our nurses and our hospitals. But if anything, I hope that we've learned to put health before economy, because without health, we don't really have much. We don't really have anything. And if we put health first, if we put our frontline workers and our hospitals and our patients and our people first, I believe that we'll naturally have a functioning economy after that. It will naturally work that way. But it was such a shift for us as a country to start doing that, to put our economy second for a little while. But I hope that's something that we can keep in the forefront as we move through this.
Lauren, thank you so much. Congratulations on being honored for the COVID Courage Profile and Courage Award. And we really do thank you and all of your colleagues in the nursing community for everything you've done for us. Truly, there's nothing that we can pay you back with all the work that all the nurses have done across the country and the world.
Thank you, guys. Just your support means the world to us as well. So thank you for giving us a voice.
Of course. Thank you so much.
Another healthcare professional who had to stand her ground when COVID restrictions became a political battle is Dr. Amy Acton. Dr. Acton was the first female director of the Ohio Department of Health. She was one of the first state health officials to recommend dramatic health and safety measures, including social distancing, mask mandates, and shutdowns to flatten the curve of the pandemic in its early weeks and months.
Dr. Acton became the target for protesters and politicians who opposed the more stringent health measures, but despite the aggressive opposition, she held her ground and put public safety above politics, earning her the honor of receiving one of the JFK Library Foundation's COVID Courage Awards. Dr. Acton, thank you for joining us.
Thank you so much. It's wonderful to be here with you.
So, Dr. Acton, you are being given this award because of your work at the Department of Public Health during the pandemic. Before we get there, can you just tell us a little bit about your background coming into the Department of Public Health as its first female director?
Absolutely. I've been a physician practicing for over 30 years. I actually began my career looking at pediatrics and child psychiatry, and it was 1990. Ended up at Albert Einstein in the Bronx, right in the middle of the crack cocaine epidemic. And sadly, half of my clinic population was going to be dead by the age of 3 by contracting AIDS in utero. And it was sort of a wake-up call for me. I started to feel that everything I was seeing was way at the end. And I have a passion for kind of getting to the causes behind the causes and actually preventing the bad things from happening. And I didn't know about the field of preventive medicine and public health, but had some great mentors and ultimately did a residency in that. And that took me to a career that spanned, some government work early on, to global health, to philanthropy and nonprofits. And then finally, strangely, getting an unexpected call from a governor I'd never met to serve as service director of the Department of Health. And I was nervous taking that on, but it was amazing because I saw a governor who had a lot of passion for the health and well-being of Ohioans. And that's often, public health is often not something you hear a lot about or politicians think a lot about. But because when you prevent things, you don't actually see them, we tend to not invest in them. But in actuality, most of our increased life expectancy has come from these collective things we do in systems at the population health level that save our lives. More than anything we do individually, it's what we do collectively. And it was very exciting to have a governor who really wanted to move Ohio's health forward.
Excellent, thank you. And then jumping ahead then to, early 2020, we all have kind of our stories of when we first kind of realized that there's a pandemic coming and what could we do? But in your role in public health, when did you realize that the virus would be so serious for not only Ohio, but for the country and, the world, in fact?
It was a gradual dawning, as it was for all of us, but mine began, I heard the news of a strange pneumonia at the end of December, but it was a World Health Organization CDC call that many of us state health officers were on in that first week of January. And it was a really revered disease detective epidemiologist. And I could just hear in her voice sort of a level of alarm that I had not heard on other phone calls. And that was just, it caused me to go to our state epidemiologist and said, what do you know about this virus? I had another odd serendipity as we started to watch what was happening in Wuhan. I had been visiting my sons in San Francisco, and I was flying back. And there were a lot of returning college students coming back from China and other countries. We have a large number of private and public universities in Ohio. We're a large state, and there were just a lot of travelers coming back. I was just like, oh, that's something to think about. I wonder about exposure. We had a college scare at a university in January. And then interestingly, I learned Wuhan was our sister state for business. And so as we watched what was happening there and listening to the stories, even early on, that spread to Japan, the Diamond Princess, that was an alarm bell for me. We had travelers there. We had travelers on the Grand Princess that was docked in California. We had travelers from Ohio on the river cruises. So, all of that was sort of ratcheting up in my mind. And we decided in Ohio, to go ahead and start doing our pandemic emergency preparedness. We built a website just in case. We just started tabletopping as our entire state government. When we continued the calls with the CDC, for me, it all came to a head the last week of February. I actually happened to sit on the board of our national organization for, state health officers representing the whole Midwest, ended up in the White House on that last week of February as the stock market crashed for the second time. It was right around when Nancy Messonnier said, go home and tell your kids, be prepared for some disruption. And I remember sitting there, a bunch of us, and just seeing, you could just feel the alarm in the room in the White House. And I remember them going around the table, and Mick Mulvaney, the president's chief of staff, was there, and it came to me, and I just thought, this is the higher angels moment. I just remember begging, sort of like, this is that Lincoln, FDR, Churchill moment where we really needed people to kind of come forward and tell us the truth. We were hearing about the Biogen conference. All these things were stacking up. I remember looking, this is so embarrassing, but actually Googling the word pandemic again because I couldn't understand. Aren't we meeting the definition of pandemic? But no one was saying it. Came back, flew back to our governor, and then we were faced with a crisis of a sort of mass gathering, Arnold Classic event where people were coming from 80 countries with over 200,000 spectators and making a decision, a really hard decision about whether or not to hold that event. And that's how it was all sort of built into this moment where really had to start making some of the tough decisions.
And can you go into kind of the process of how you evaluated, how did you make those decisions? You talk about having these mass gatherings that people kind of expect business as usual to happen. How did you make those decisions, those really hard decisions, but important decisions too?
Well, I think it's important for everyone to understand that we have and have been planning for pandemics for quite some time. It really goes back to the George W. Bush White House. And actually, post 9/11, look at what are some of the grievous security threats. And even then, George W. Bush had read John Barry's book on the great pandemic, the Spanish flu, and he recognized and formed a team around the fact that it's not just the virus. A virus disrupts everything and it becomes this more massive global security risk, as we have now seen. So there was a plan and it was renewed over the years. Great, work in the MMWR from 2017, but then had been allowed to languish. And so we dusted off that plan and began to work from that. But one of the hardest things is it really was meant to be led as a federal thing. It really, had never been envisioned to fall to all the governors. And I have to say, we can't thank these governors enough. They really pulled together and across the aisle, a lot more than people often imagine, to help each other. But we dusted off that plan. I had a serendipity. A couple serendipities happened. One was one of the initial authors of that plan for George W. Bush in the White House happened to be someone who went to my med school and was the brother of my communications director. So I was able to get him on the phone and go, tell me, what do and he could lead me to the best scientists really in the world. Once we had this, my governor is a great communicator, and we just decided instead of trying to answer all the questions, we would start a series of, press conferences every day at 2:00. That became sort of this holding space for our entire state and really a pattern for the country. And once we told the truth, we realized we'll just tell the truth that we know about each decision we're making. And that truth was we knew we had 2 weeks to get some tough decisions made. What they had learned was that in the case of the pandemic in 1918, there was a big difference between what happened in Philadelphia and happened in St. Louis. 2 weeks had made all the difference in the trajectory of the spread of the disease. We knew we had no PPE. We knew the global supply chains were down. We knew this virus was spreading in a way. We already had community spread, but we didn't have testing. We didn't have contact tracing. We didn't have doctors who were lined up who knew what to do. We knew we had to buy time to do the preparedness. And so we started following that plan. We started telling the truth at these press conferences about it, including what we didn't know. And then the scientists, who many had gone underground, there was a lot of political pressure on scientists in the beginning. They started calling us some of the best scientists in the world. So once my governor led, more and more people started to come to us with, here's what you need to know. Here's the modeling. Our hospitals started doing modeling. We were able to get scientists to help us. And we just sort of moved from there step by step. And people need to know this. We were buying time. It was never meant to be just the orders or just the shutdown. Even in the beginning of the shutdown, there were plans underway and strategies. How do you open up once you build contact tracing? How do you open smart, wise, and with what data? So there really is meant to be a whole wraparound that occurs for small businesses and policies and procedures, and all that needs implemented. But it really needs to be led as a whole, as a country, and a whole as a world. Here we were trying to do it a little bit state by state.
You mentioned all the people that you worked with that were helpful, but there was a lot of opposition and politicization of sort of the health directives that you were putting out. As a health official, were you surprised at the reactions you were getting from the general public and some politicians and others who were maybe using the mandates as a way to stoke political opposition?
First of all, even back in the time they made the original plan, it was known that a global pandemic is almost like a war on a silent enemy. And there are opportunities in that. I used to teach in my global health class that if only we had aliens invading from outer space, we'd all of a sudden find a way to all be on the same team. And just like 9/11, remember that feeling of everything falling away, and we were all sort of united for a period of time. That happened at the beginning of this pandemic too. There was an amazing falling away of all the rhetoric, and there was truly a reaching across and everyone trying to help one another. But it was also predicted that in the chaos and in the ambiguity, people would intentionally take advantage of that chaos, intentionally use that. And whether we saw that coming from other countries or within our own country. And unfortunately, we'll always have to rue the fact that it was a presidential election year that this happened in. And we started to see that there was just the chaos and normal ambiguity that would cause people to question things, which they should question, complicated policies. But then there was also, as we now know, even from Bob Woodward's book or looking at some of the quotes from Jared Kushner and others, sort of an intentional sort of, take this back from the doctors or doctors versus economy. And that's not true. It really is a complicated set of policies that takes all of us. Let me tell you, there's a lot said about that kind of, in our case, somewhere around April was the first time that you see the famous pictures of faces pressed against the glass while the governor and lieutenant governor and I were talking, holding, assault rifles, through very thin panes of glass at the State House. And people had a right to be upset. There were hard policy decisions being made and all those folks being at the table to try to weigh in. What you don't see about there is the overwhelming people who pulled together. We often hear the loud voices or see the disruption, but the truth in Ohio was 80% of the people were rowing in the same direction. Our mailrooms, even during the midst of that, rooms that were bigger than my whole house, that we get mail at an institution like the governor's office or the department, full of things Ohioans had sent. To this day, I have bedrooms full of letters that just keep coming of Ohioans who were like wanting people to row in the same direction, who really were supporting what was going on. But that's not the stuff you necessarily hear about in the middle of something like that. You definitely see the sort of the protests. But what really was happening, it was 80% of people were reaching out across the aisle, trying to work. Even governors who outwardly are saying one thing, there's a bit of theater. Even in our State House, I was getting flowers from people that were maybe outwardly not being able to speak loudly, but were behind the scenes, understanding what a difficult road this was. But unfortunately, that politicization is something we need to anticipate and build into our pandemic response in the time to come.
And can you, in addition to, you mentioned you had daily, 2 p.m. press conferences. And was that one of the ways to, as sort of information about the pandemic unfolded kind of almost on a daily basis, how did you handle that and communicate that to either your other Ohioans or other people you're working with in the medical field? You mentioned the press conferences that were every day. Was there anything else that you did to kind of keep everybody up to date or handle the constantly changing intel?
This is, when we think about the future, risk communication and crisis communication is just the words of our leaders, the actions and words of our leaders matter so tremendously. That's why I'm saying that's what came to mind, the higher angels, like the need for our leaders to be sort of that holding space to help us tolerate the intolerable. How do you shut down a country? How do you tolerate something that none of us can predict, our lives completely being disrupted? There's nothing more powerful than the words our leaders use. And again, I'm so blessed that we sort of stumbled into creating that space, and keeping trust is everything. We did create a hotline. We did create and man that hotline. We did create a website, but it really was sort of the steadfastness of showing up, and the fact that we were all at home. So people, it became, there became this whole world around wine with the wine and cartoons made, and a whole ecosystem and culture around us coming together, and that safe space we were holding. And you probably might have seen, ultimately the New York Times did a video look at, it was called The Leader We All Wish We Had, but it was about like, how do you lead and communicate? And it was this very elaborate, almost linguistic analysis. And I'd love to tell you that I was so intentional about my choice of pronouns, or, I was actually supposed to, we all get this leadership press training as part of the CDC. And I had to miss it because I tripped over my dog gate and broke my pelvis. So I had never been trained even for this moment. And my kids would tell you, that was just our mom. This is how she talks to patients. This is how she talks to us. But they broke it down, and I think they broke it down. There are powerful lessons in it. For me, telling the truth was the first one, the brutal truth. I had a pretty rough childhood growing up. And to me, in a time where we're talking a lot about gaslighting and intentionally social algorithms and media and how we're drinking Kool-Aid and being fed things, telling the truth, even if it's truth that seems like people wouldn't want to hear it, getting that on the table allows us to begin to make how we're going to get out of it. So telling the truth, no matter what it is, I just saw that craving in people. And I will tell you, for our leaders, it is what the quiet, silent majority wants. They just want the truth. Just tell us the truth. And we told people what we knew as we knew it, and what the weaknesses and strengths to what we were knowing was. And you have to maintain that trust all along from the beginning. Secondly, vulnerability, to be honest about that. That's not something that is usually seen. And for our leaders, you had to be a leader who said, maybe it means I don't get elected again. Maybe it means the loss of my job. But that this is one of those moments where the people we're leading is bigger than any future career I might have. We've just got to be real. And then we did another thing in it, which was empowering. What is the call to action? What could people do? And I can tell you, it was Ohioans who saved lives. Ohioans went to their neighbors who couldn't get out. We had this call to action and movement in our state, which for the rest of my life will be, again, it's what we all wish to live with. And we saw it happen. And I want to see more of that. And I think Ohioans and our citizens want more of that. And our leaders going forward, that's the leadership we're all craving. And so, our words matter, and people can tolerate ambiguity, but we need to communicate. We need to communicate differently to help empower people. And I hope that's something we learn from this.
Yes, I agree. And you've done a lot of different work during this pandemic. You at one point left your job at the state health department. So what has that transition been like since leaving your role? How do you continue to use your expertise to help Ohio through the pandemic?
Well, once you, in a strange way, you become the doctor for 11.7 million people. And it doesn't, I had lived a whole life being for all people. I'm not a partisan person. And once you feel that responsibility, it doesn't leave you. You can't shake it off. And for me, even once I was out of the role, I continued quietly and work with people on both sides of the aisle, continued to work with people in the national government, became very concerned that the biggest part of the pandemic was going to hit, as we now know it did, right during the presidential transition. And so became, was involved in sort of the New Yorker piece about the heart and soul, because I was very concerned about, as the new administration came in, knowing that it was this bipartisan group of governors that a president-elect could engage. Can't govern yet, but he could engage and be that higher angel message while the governors help move us through, what we finally saw in our state, what I had predicted, the more than 10,000 cases a day actually came to be. But my work also, I returned to work, at the philanthropy I had worked at before the pandemic. And what I realized was, the work I was doing was around kindness and justice, because I knew that people are very weary of the vitriol and hate. They're very weary of this division. The majority of people realize that we're getting a chance again to rebuild something. But how do we do that? How do we have the hard conversations and come to tables, but do it in a way where we recognize the human dignity of each other, and not just shut down the dialogue before it can even happen. And there's a lot of great work in science, and kindness is not a trait thing. This is the way I was describing it was fierce kindness and justice for all. Kindness is not niceness. Niceness is like lying and not telling the truth and kind of just going along to get along. Kindness is, thousands of years of, it's an amalgam word for everything that every religion and society has tried to idealize about the cultural glue in which we recognize one another. Kindness is science-based, both looking inward, because we know that some of the worst violence and even the worst things we're going through in the pandemic are the mental and emotional and the languishing that Adam Grant is talking about, the suffering that we're going through. And how do we, first of all, have that loving kindness to ourselves, which has been proven. There are actually skills you can learn to help yourself have resiliency and strength through the unbearable that we go through, the unbearable. But also how when we reach out to one another and co-create our community and come to those hard tables and have that generosity to one another in the little ways and the big ways, that is like improves our health and well-being and then raises up our communities. So, public health is about creating conditions in which all of us can thrive, in which all of us matter, in which all of us have purpose and meaning. And so my work has always been about that. It's been about that as a professor. It's been about that in nonprofit. It's been about that in government. And we get a chance again to do that. So in the worst of the hate and the worst of the vitriol is also the moment to build that, social equity and glue again. And I'm really interested in how we do that.
Thank you.
Do it intentionally.
Would you consider going back to public service of some kind if asked or if you desired?
Well, I can tell you that it was an honor of a lifetime to serve in this way. I mean, I am changed. And I was talking to you before our call started, I'm really taking some deliberate time right now to reflect a little bit. This experience has changed me. My whole life has been public service. It's social justice and my experiences growing up sort of in the leadership of people, like a John Kennedy and a John Lewis and all the heroes of mine that have gone before me that have tried to create, the Ella Baker, create the light and people will come. That is, we all wonder what we'll do in these moments, how to not look the other way. Will we have the ability to do what we need to do when we face it? And there's nothing I want more than to keep doing that. How to do that and how to best do that is a question all of us ask. I'm such a wanter to bring people together, and I am still learning for myself. How do I best do that? How can I best be of service? But I want to say service happens in every sector, in every institution, and how we again work within our own families and work within our own communities and our own neighborhoods, and then in our governments. And I see especially young people right now, this is like the young people are ready and they're excited. And this pandemic in so many ways is an opportunity for all of us to kind of engage democracy, engage civic life differently. And I and others, this moment's calling all of us, and it's not about our politics. It's about our humanity and the kind of world we want to co-create. So I really feel that this is a call on all of us, and a moment where we can kind of reevaluate the kinds of lives we want to live and the kinds we want to live together, because we are interdependent, whether we recognize it or not. If this moment didn't teach us that, our lives are so interwoven. And I feel, I do hope that I have the opportunity to keep doing this kind of work. Yes.
I think that's a really great place to end on, actually, for this interview. Dr. Acton, thank you so much for your time. We really appreciate that you were there, and thank you for all you stepping up.
Yeah. Take good care. Okay.
Take
Thank
care.
you.
Thank you so much.
Thank you for listening to this episode of the JFK 35 podcast, a podcast from the JFK Library Foundation. We hope you enjoyed this episode. Visit our podcast page at jfklibrary.org/JFK35, where we will have more information on the COVID Courage honorees and how you can still watch the replay of the virtual ceremony.
If you have questions or story ideas, email us at jfk35pod@jfklfoundation.org or tweet at us at JFK Library using the hashtag JFK35. If you liked what you heard today, please consider subscribing to our podcast or leaving us a review wherever you get your podcasts. Thanks for listening and have a great week.